Not every dandruff is simple. Sometimes it's a chronic inflammatory condition that keeps returning again and again. A condition that may look minor on the surface but silently affects comfort, confidence, and even social interactions. Today, let's understand seborrheic dermatitis, not just from textbooks, but from a real clinical and practical perspective. Seborrheic dermatitis is a chronic relapsing inflammatory disorder primarily affecting areas rich in sebaceous glands. It is extremely common in day-to-day practice, yet often underestimated, misunderstood, and inadequately treated. This condition is not limited to the scalp. It extends to areas where oil production is naturally higher, like the eyebrows, nasolabial folds, behind the ears, and sometimes even the chest. And because these areas are visible, patients often feel more distressed. The disease develops due to an interaction of three key factors: the fungus Malassezia, excess sebum production, and an exaggerated immune response of the host. It's not just an infection, it's a complex interplay between the skin and its environment. The fungus feeds on sebum and breaks it down into free fatty acids. These fatty acids irritate the skin barrier, leading to inflammation, scaling, and persistent itching. So, what looks like simple flakes is actually an ongoing inflammatory process. Certain conditions increase susceptibility, especially immunosuppression, neurological disorders, and chronic stress. Sometimes severe seborrheic dermatitis may even act as a clue to an underlying systemic imbalance. Patients typically present with greasy scales, erythema, and most importantly, itching. And the hallmark feature a chronic relapsing course where symptoms improve but often return again and again. Why recurrence? This is one of the most common concerns patients express. Doctor, it keeps coming back. And the reason is simple. The causative fungus is part of normal skin flora, and sebum production never really stops. Without proper maintenance therapy, recurrence becomes almost inevitable. Treatment is not just about removing visible flakes. It is about addressing the root cause, controlling inflammation, and maintaining long-term balance of the scalp and skin. That is where most treatments fail. They focus only on the symptoms, not the disease process. Ketoconazole shampoo remains the backbone of treatment. It should be used 2 to 3 times per week for at least 4 weeks to achieve proper control. And once symptoms improve, maintenance therapy once weekly for several months is essential. Because stopping early is one of the biggest reasons for recurrence. Technique matters more than the product itself. The shampoo should be applied on the scalp, not just the hair, and gently massaged. Most importantly, leave it for 3 to 5 minutes so that the active drug gets enough time to work. Quick washing often leads to poor results. Topical steroids can provide rapid relief, especially in cases with severe inflammation and itching, but they must be used cautiously, only for short duration, typically 5 to 7 days, and never as a long-term solution because misuse can lead to more harm than benefit. For facial involvement, antifungal creams are preferred. They are effective, gentle, and help control lesions without causing damage to sensitive skin. Even after visible improvement, treatment should be continued for some time to prevent relapse. Keratolytics like salicylic acid help remove scales, and this step is important because without removing the scales, topical medications cannot penetrate effectively. So this is not just supportive, it's a necessary part of treatment. A phased approach gives the best results. Start with intensive antifungal therapy, then gradually shift to maintenance, and sometimes alternate with agents like zinc based shampoos. This structured approach helps prevent relapse. Each ingredient has a specific role. Ketoconazole targets the fungus, zinc helps reduce scaling, selenium controls cell turnover, and salicylic acid removes scales. Choosing the right combination makes treatment more effective. Conditioners are often ignored, but they play an important role. They reduce dryness, improve hair texture, and most importantly, increase patient compliance. But remember, apply only on the hair shaft, not on the scalp. Most treatment failures are not due to lack of medicines, but due to incorrect usage. Stopping treatment too early, overusing steroids, poor scalp hygiene, and irregular shampoo use. These small mistakes lead to big recurrences. On simple principle, control the itching. Because once itching is controlled, patients scratch less, inflammation reduces, and hair quality automatically improves. Seborrheic dermatitis is a chronic condition. It may not be permanently curable, but it is definitely controllable with the right treatment and the right habits. And that is the goal of management: control, not cure. In chronic conditions like this, consistency matters more than intensity. Small, regular efforts create long term results. Seborrheic dermatitis teaches us an important lesson. Not every disease needs aggressive treatment. Some conditions need understanding, patience, and a disciplined routine. Because in the end, the best treatment is not just medicine, it's consistency.